Tonight we address a disease that affects more men than women. All right, so we're talking about this week and what topic we're gonna have on our 30th anniversary uh, of Hump Day Conversations. So for those of you that are live, if you've enjoyed these conversations so far, we've had 30 of them. Give us a thumbs up. We've shared a lot of information in these last 30 episodes that most of you will not get from anywhere else unless you really ask questions. And it's something that that we've loved to share, and we've loved to have people live and chime in with questions. We've had question periods. We've had a few invited guests on there. So thank you so much for being there with us. And tonight on our 30th anniversary, we talk about Parkinson's, and already prevalent. We have a live guest tonight who's had his family touch with that. And yeah, you want to begin, Ben?
Sure. Yeah, I would love to start this off. Parkinson's, it's a condition that's very near and dear to me. It doesn't run within, my family. I don't have close family members that were impacted by this disease. However, this is one of the first conditions that I started working with. And so when I started to develop this passion to become a doctor and working with certain populations, I had started working in the Parkinson's Project, which was a project through St. FX. And so the Parkinson's Project was geared for kinesiology students and worked with a clinic locally in Antigonish to help those living their lives with Parkinson's reach goals, mobility goals, flexibility goals, and strength goals. And so we put together programs of care and worked with individuals with Parkinson's to help them have increased mobility, balance as well. And so when we sort of talked about, okay, what do we want to do tonight? And Dr. Roach had mentioned, maybe we should go to neurological stuff. Parkinson's had come up. And so Parkinson's is a progressive nervous system disorder that affects movement. And so it actually slows down the individual's movements. And it's the second most common neurodegenerative disorder. And so the symptoms start very gradually, and then they progress and get worse over time. And normally, by the time that symptoms are bad, that's when people really start to notice, okay, something is going on here.
Yeah.
So basically, facial expressions are impacted. You can have a wide stare with a lack of blinking, and it usually, the incidence people normally said, like I said, you normally notice it in your 60s, but you can start to really notice it in your 45 to 65 years old, and difficulty with movements and the tremor. So the tremor is the number one thing that you're going to notice first. And a tremor, for those of you who aren't familiar, for those of you that are, tremor is this shaking of the hands. So the movement is very much impacted. And so when the individual is trying to move, the movement is slowed and uncontrolled. And so you can kind of see I've got this sort of like that.
Yeah. The expression is always when you talk about the facial features, they say it's almost mask-like. Like if you see somebody wearing a mask, there is no facial expression. It's just a blank stare, right? It's we had a family friend that was affected by Parkinson's, and they would just stare into in the middle of nowhere, and very, very characteristic of Parkinson's.
And so the individual may not have a specific complaint, but they may still show signs like very rigid motions, bradykinesia, which again is the slowing of movement, resting tremor, and walking difficulties. And so the individual will often present with what we call as a shuffling gait. And so it's a very wide stance gait with very short steps, almost like shuffling. And they'll even slide their feet along the floor there.
Yeah.
And so that as well is a common sign, because the muscles are getting very fatigued and tired, and they don't move very quickly. So the stoop posture is very common.
One thing that happens, one second, Ben, with the gait, while you're mentioning the gait, what happens, they have a very hard time initiating movement. So they almost have to, you could see them, they get up from a chair, and then they got to take that first step. But the motor cortex, the brain doesn't process this, and we'll talk about why later.
Mm,
And they almost have to lean forward to the point where you think they're going to fall, and
mm,
then their feet catch up from underneath them, and in short little steps. So it's the inability to initiate movements, and then finally the feet catch up with short shuffling steps.
mm. Yeah,
Yeah.
and that is a really good point. And just going back to the first thing that we sort of talked about that I alluded to when I worked with this population, some days we were having great success, right? Some
Yeah.
days it was very easy to get going, and other days it was tough, right? Other days there were a lot of balance issues, and then some days it was good. And so it is one of these conditions where it's in waves almost. And so there are other complications as well, and not just the physical manifestations, but also thinking difficulties. So a lot of these individuals will also have things like dementia or other thinking issues, and those normally occur later on. Depression or emotional changes. So they can change from one feeling to the next very quickly. You can often see this in early on. Anxiety, loss of motivation, swallowing difficulties. We have to think about all of the muscles, right? And so it's very difficult for these individuals in late stages to actually swallow saliva. So oftentimes you'll see the individuals, drooling from the mouth, right?
Yeah. Yeah.
So again, what comes with the swallowing difficulty is also this difficulty chewing, right? Again, anything that the muscles are being used for, it's going to be slowed down.
Yeah, including bladder control, digestion, right, constipation. The muscles aren't active, so what's called peristalsis, the digestive tract pushing food along into finally, the big intestine is slow. So a lot of people develop constipation. So anything that has muscle has the ability to be impacted by Parkinson's.
Hmm. Well, one of the, and just before we move this slide, I just want to point out a few things because this photo here does a really good job with some of the stuff that we're going to talk about later on. And
Yeah.
so one of the points there is reduced arm swing. And so because again, it affects the muscles, the arms are used to help us ambulate and walk. To have a proper gait and have proper swing phase, the opposite arm has to raise while the opposite leg takes a step forward. And so you can't get that proper swing phase. You can't swing through and have proper balance if your arms aren't moving and ambulating with your
Yeah.
legs. I just wanted to mention that before we carry on because we'll be talking about that later.
Yeah, and one last thing, somebody had asked, is it hereditary? Parkinson's can be hereditary, but it's not common to be transmitted in a hereditary way. But although it can, but it's not that common. Is that correct?
Yeah, that,
Yeah,
that's what the current research is
yeah,
saying is that it's, there are, links, but the links are very small. And so a lot of things too, they often say environmental factors can also play a role. I'd read one thing, it just said toxins, so I'm not 100% sure on those exact environmental factors. However, when it comes to hereditary, running in the family sort of thing, it's a very loose connection.
yeah. And also, the symptoms will progress as they progress. Whether you're diagnosed, a little younger or later, there are types of symptoms that you see early that may have been missed. God knows, and maybe there was a lack of clinical diagnosis that was specific, and there was still kind of undetermined. And then later on, you get the symptoms that happen later, and then more in later stages. Those are going to happen no matter what, whether the diagnosis is early or not. Although sometimes some of the medications that you can be put on can halt the process a little bit.
Mm.
But yeah,
Yeah,
what do you got
it's
here?
yeah. So we have a cross section of the brain here, and a little bit of a cross section of the area of the brain impacted there by Parkinson's disease. And so this is basically the findings, right? So in Parkinson's disease, certain nerve cells in the brain gradually break down. And so the area known as the substantia nigra actually begins to break down. And they're supposed to produce a chemical messenger known as dopamine in the brain. And dopamine is supposed to help us initiate movement. However, when dopamine levels decrease, it causes abnormal brain activity, especially in the frontal cortex, leading to impaired movement and other symptoms of Parkinson's disease.
Yeah, so I mean, dopamine is super, super important, and when you don't have dopamine, and we can talk about this now, is that you have nerves that communicate with other nerves that make it down a muscle and give you the ability to contract the muscle, and also part of our ability to contract our motor nervous system comes from the brain as well. So what happens when there's less dopamine hanging around the brain, then the conductivity of those motor impulses that allow us to move and ambulate start to slow down. So we call that inhibition. So we have inhibition of the motor cortex and premotor cortex, which doesn't give you the ability to move as fast as you should. So everything starts to get slowed down with Parkinson's when it comes to muscles.
Mm-hmm. Yeah. And so we're not able to send these sort of efferent messages, right? So when the brain
Yeah.
communicates with the muscle down, we can't send that because the information that's being sent to the brain from this area of the brain, right? If we just think maybe the area of the brain that's impacted is here, if it's trying to send information here, this afferent impulse is not getting sent there properly. It's all mixed up. So then the information that's coming there is all kinds of upside down, and it's being
Yeah.
sent upside down to the body. Um, just looking
Yes.
at the, yeah, did you want to mention that cross section and what we're seeing there?
Yeah. So, but one thing I wanted to say is, this is also the reason why, like with the dopamine shortage, why you will see changes in behavior, depression, and all that stuff, because dopamine is super important with that as well, right? Like your
Mhm.
drive, when that starts to slow down, that's why you have those mood, psychological depression, all that stuff happening at the same time that you're seeing um, muscular deficiencies and all that, right?
Yeah.
So this area here, like where the substantia nigra uh, is called your basal ganglia, and your basal ganglia is basically where you are going to have the ability to control movement. So there are different types of movement, and specifically different types of tremors. So one thing that we wanted to mention is that when you have an intention tremor versus a resting tremor. So Parkinson is known for its resting tremor. As a matter of fact, when you start moving, part of the tremor starts to go away. You're just slow moving. But when you have a tremor that's controlled by the smaller part of the brain called the cerebellum, that's when you go to bring, a fork to your mouth, and the tremor gets worse as you get closer to the mouth. That's
Mm.
called an intention, because there's an intention to bring the fork close to your mouth. But Parkinson's, the tremors are going to be resting. So you can observe somebody as they're, sitting on a chair, they'll have their hands in their lap, and their hands is going like this. That is called a resting tremor. Very, very what's called pathognomonic, or it signifies that this could be a Parkinsonian type of reaction.
Mhm. Yeah.
Yeah.
And so when we look at that basal ganglia there, just on like the image to the right, you can see that the lines are pointing to the substantia nigra. And so substantia nigra is supposed to be a dark colored structure there in the basal ganglia. And so on the right there, that Dr. Roach just circled, that's normal. You can see it's nice and dark. Now we look to an individual with Parkinson's disease and we see that there is very little of that substantia nigra left. It's lost a lot of its pigmentation. And so the loss of these nerve cells is usually a very slow process. And
Yeah.
so the symptoms of this disease is usually only seen, and this is what the research says, when 80% of those nerve cells um, have been lost.
Mm-hmm.
So really by the time that you're starting to see some severe symptoms, you've already lost 80% of those nerve cells,
Yeah.
which is fairly significant. It's more significant than anything else at that point.
Yeah.
Um, so that's really the big finding, as far as that cross section is concerned. There's also something, and this is going into some of the research that's being done on Parkinson's these days, is that researchers are finding something called Lewy bodies, which is a substance in the brain. And they
Mhm.
find this in individuals with Parkinson's, and they believe that these Lewy bodies are involved in that process. However, more research needs to be done to confirm, how these Lewy bodies are involved in the disease, and eventually, coming up with a cure, to help determine how we can stop the destruction of the cells.
Yeah. And Lewy bodies, I'm sure some of you have probably, heard the term Lewy body dementia is when, people start to have dementia. It's not really Alzheimer's, but it's related to Lewy bodies. And now we're starting to see a link between Lewy bodies and Parkinson. So yeah, that's great. Great information. So guys, at this point, as we always do, if you like this information, just give us a little bit of a thumbs up or a heart. If you've learned something so far, again, this is a disease that affects more men, and the second most common neurological disease here in North America and in the world, I think.
Yeah, it's really common in North America, worldwide common as well.
Yeah. All right. So, what can we do about Parkinson's? Obviously, we're not going to solve Parkinson's. This is a slowly progressive disorder that, even the brightest minds of medicine have still not figured out. There's advances being made, but what we want to do is provide perhaps a prolonged, uh, slowing or increased quality of life through making sure that your activities of daily living are being improved to the full potential of what they can be based on what's going on neurologically with Parkinson's, right? I think that's the best
Yeah,
way to put it. Yeah.
yeah, and I mean, we talk about some of the things, right? Like this stooped posture that the patient presents with, the shuffling gait. There are going to be some compensations developed from that idea of Parkinson's alone. And so when we talk
Absolutely.
about balance, when the head is falling forward in front of the feet, this can lead to a fall, right? And falls are the number one cause of disability in individuals over the age of 70.
Yeah.
And so a fall can be detrimental to an individual. And so managing the risk of a fall is one of the more important things, other than just managing, the symptomatology of Parkinson's alone. We can enhance your quality of life by giving you that improved balance.
Yeah, when you think about it, like people with Parkinson's have a lack of extensor tone, so they're always flexed. So literally, it's almost like you're sitting all the time, and we know how detrimental sitting all the time can be. Like your hip flexors get tight, your back is stooped. So imagine, you know, if you were like that every day, bending forward. We always say, stand up tall, have good posture. Well, these people can't have great posture because there's a neurological uh, pathway that's being generated that's allowing this to happen. So a lot of these people end up with low back pain, right? And
Hmm.
they're shuffling all the time. Nothing is the way the body was made to ambulate. It's all different. So there's tons of compensatory muscles that start to chime in. So that's a great point.
Yeah, and my second point, like the second point that was in here, is removing nervous system interference and stress reduction. And so one of the points that I like to talk about with new patients is that whenever we have restrictions, whenever we have issues with the spine, where it's a little bit subluxated there, the muscles in the front get really tight. And so namely, I always talk about, the pecs are really tight, our deep neck flexors get really tight. And
Yeah.
so a part of adjusting the spine is to remove some of these interferences, and so
Yeah.
that we can activate the muscles in the back and reduce the amount of tone in the front,
Yeah.
right? And so this is one of those conditions where that's just a perfect example of how these restrictions in the spine are associated with this hypertonia in the front and lack of tone in the back, which as a
Yeah.
chiropractor, we look at that and say, well, we got to start removing these restrictions so we can get some tone going in the back here.
A lot of times you can even see because of the flexor tone and the head going forward, you can start seeing people with Parkinson's, and I've seen plenty that start getting numbness and tingling in their hands, which is basically by virtue of their positioning that the condition is putting them in. So to alleviate some of the things that are, I mean, they're already going through a whole lot. So anything that we can reduce by virtue of treating the compensations, it gives them a better quality of life, is what it comes down to.
Yeah. Yeah. Proper development of the function of the brain relies on the structure, right? And the movement
Absolutely.
of the spine. And so we have to work on moving the spine, keeping the structure nice and strong with that mobility so that we can have less of the other issues, right? We haven't even gotten
Yeah.
into, well, this predisposes somebody for arthritis and disc issues, right? And we talked about, yes, pain traveling down the hand. So there's other things that can happen that aren't necessarily Parkinson's that are happening that can be taken care of with chiropractic care.
Yeah.
Um, I'd also written in here range of motion, mobility, and coordination exercises. These are things that can be given at home as sort of like homework for yourself. And like I said, when I was at St. FX, we worked a lot. I was in kin, and so this is the study of human movement. And so we did like range of motion exercises, mobility, balance, coordination exercises with these patients to help them, have a better quality of life so that they could go
Yeah.
home and manage their symptoms by themselves.
Absolutely.
So one of these things as well, and I wanted to look into the research. It's been a little while since I've taken up a study for you guys and took it out of the vault there. And this is chiropractic management of an 81-year-old with Parkinson's disease. The individual had the signs and symptoms that we spoke about earlier. So this resting tremor, a shuffling gait, a kyphotic or bent spine with a forward head posture. He used a walker and had short, abrupt steps, and he fatigued fairly quickly. Um, and he would stop all the time because he couldn't go very far without feeling like, he couldn't make it there. Severe anterior head carriage, and his kyphosis was 20 to 25 degrees forward flexion, and so that's quite significant. And like Dr. Roach was talking about, they have hypertonia, and so they're very tight in the front. And he was unable to actually straighten his back because of how tight things were in the front. Now, this is all in the research. You guys are welcome to read this as well. Um,
Hey, Ben,
so
just one
yeah,
second. I just want to say, like, a lot
yeah,
of you don't realize the importance of extensor tone, right?
yeah,
When a child is born, it doesn't have extensor tone, right? That's why, as soon as you put it straight, it falls forward. So extensor tone is developed. That's why it's important for kids to have belly time,
mm,
and important for kids to be born naturally so that when they go through the birth canal, they can lift their head up to have extension. So that creates that neurological reflex for the extensor muscles to start to develop. So, belly time is very important. So when the inability to create extensor tone or the inability to control flexor tone comes into play, a lot of things cannot occur. So, for example, when you go to get out of a chair, you need to go into extension to get out of the chair. So, a lot of these people, in terms of we're talking about activity of daily living, a lot of these people can't get out of a chair because they're stooped in it and they can't extend and go upright, which requires extension. So, they can't
mm,
do that. So, uh, it becomes a very, very huge hit on their quality of life when you don't have extensor tone.
yeah, totally. Definitely a great point. And so that's why part of this adjusting and what they did in this study here is they adjusted the individuals actually standing. And so this
Yeah.
particular chiropractor adjusted this individual with this lack of tone standing to encourage that extension, to encourage that upside, that upright posture there. And going back to this walking gait, right? And so they're trying to create these neuroplasticity. And so we're trying to create changes in the brain pathways so that the individual has better communication between the structures that are not functioning properly and the structures that it wants to go to in the rest of the body. And
Yeah.
so they worked on, working on swinging and doing exercises to help coordinate those movements so they could eventually create those pathways. Because if you don't use it, you lose it. So you need to practice, right?
Yeah.
And so, especially with a condition like this, where you're beginning to lose some of those things, you have to make sure that those pathways stay well lit up.
Yeah. Great
Um,
point.
another important concept here with neuroplasticity, and this is right out of the study. So the adjustments were done. Fast stretch reflexes um, were done to elicit intrinsic spinal musculature to excite the cerebellum. So they're trying to get this area of the brain to excite,
Yeah.
so that they
So
could
what?
send. Yeah, they just want to
Yeah.
send information, like proper information, down to the body, so that
Yeah.
it's no longer getting this poor, lack of dopamine type movement. They just want to
Yeah.
encourage that. I just want to reiterate that point there.
Yeah, no, that's very important because what you can do in neurology is you can do what's called fast stretches. So let's say, for example, your biceps is contracted, which a lot of these people are. You can do a fast stretch of the biceps. So you basically stretch it real quick and you kind of put like an impulse, kind of like a chiropractic push. And when we push on the spine, and what that'll do, it goes to the brain and then automatically allows the extensor to contract. So that's called a cross cord reflex. And definitely that can be used to excite parts of the brain that we know are deficient. So
Yeah, and
definitely.
that's also a really good point too, and it brings me to this point that I have about vibration therapy. And so they actually did this thing called vibration therapy in this study as well. And it was used to elicit that plasticity in the basal ganglia, sort of as a distraction, right? And just to
Oh, yeah.
provide temporary relief to the patient's tremor. And so when they actually did this vibration, it provided this distraction to that area and caused the tremor to go away. The exact mechanism still is poorly understood, but the idea of using vibration as a distraction mechanism to help sort of take away a tremor is really interesting.
Yeah, no, absolutely. Um, I think there's a lot of things that can be done with Parkinson's with what we call functional neurology. A good example, and I'll kind of step away from Parkinson's for a second. People that have a stroke and they've lost the ability to move one limb. One of the amazing things you can do is you can actually um, trick the brain, and a lot of them will do what's called mirror therapy. So they'll put a mirror here and they'll put the arm that can move, and what the person does is looks at the mirror, sees the hand that can move, but the brain thinks that it's the left arm that's actually moving. So now you're creating synapses to the brain that now thinks that you're moving the left arm to get some excitations, to get movement in the arm that's been paralyzed by the stroke. So there's many things that can be done neurologically to help these people. Um, I can't think of a good parallel example with Parkinson's, but definitely neurologically, you can improve these patients up to a certain degree until the disease takes over. But again, from an activities of daily living standpoint, quality of life, my gosh, there's a
Yeah.
lot of things that you can do for that.
Yeah, and so that was kind of the big result of the study, was that the patients saw improvements in the activity of daily living and well-being, which should be the ultimate goal, right? Because in a progressive neurological disorder, um, the condition it only gets worse or it stays the same. And so the idea would be to keep as much as you have at this point. And that's
Yeah,
exactly what we did with the Parkinson's project, was to keep individuals moving in that way. And that's what they did in this study here, the chiropractor. So the individual saw most of the improvements take place in the first 2 months of care. And this was at twice a week. And so the individual began at twice a week for a certain number of weeks, started feeling really good, and then continued at once a week, and continues, according to the study, at the once a week frequency to maintain the structure built and maintain the progress. Because once you start seeing the progressions, you don't want to sort of see any of that digress and go downhill,
yeah,
which is completely understandable.
yeah. One of the things I'll mention too is once the gait starts to be really affected, one of the things that I told patients, it's tough to go to a cane because the cane allows you to be able to flex. Like it's far easier to have a walker where you can have both hands and you can have both hands trying to push you up into extension. So again, thinking of the overall effect on the spine, having a unilateral device like a cane tends to push you in an asymmetrical posture that again is not going to help your overall condition.
Yeah, yeah, having a lean and whatnot,
Yeah.
one side. Yeah, and you know what? This study even goes on. It's a pretty amazing study, and the individual actually stopped using their walker. They could stand up much straighter. Now, this was performed in 2014. It'd be great to have another follow up with this case study. But I just thought that it was an interesting point to bring up, especially considering that we were talking about, okay, how can chiropractic play a role in a disease such as Parkinson's? So, hope you guys
Yeah.
enjoyed that.
That is, that's a great study. I like the fact that, he wanted to continue care because he was afraid he would return to his previous state, right? Like once you improve, then you realize how many problems you were having. It's like people that have pain and now they have no pain. And even though they said, well, the pain is not so bad, but when they don't have pain, they realize how much it was impacting their life. And like, oh my gosh, I don't want to go back to where I was.
Yeah.
So, that's true with even without Parkinson's. Um, what else you want to mention, Ben? Is there anything on this slide else? Something else?
That is everything on that slide. um, and really just hitting home on the benefits of the adjustment,
Yeah.
and hitting those, working on those motor patterns and getting those grooved in, and getting the
Yeah.
tone in the back muscles working properly, right? I think that's our greatest benefit,
Yeah.
providing that tone for the patient, encouraging those back muscles to fire.
I see a comment that just came in, and here's what I want to say. If you have someone that you love has Parkinson's, and you tell them, look, maybe you should check out a chiropractor. One of the things that they're going to say is, well, I'm going to ask my medical doctor. I'm going to ask my neurologist. The answer to that is going to be, well, no, you shouldn't see a chiropractor, because they're making the assumption that the reason they want to go to a chiropractor is to fix their Parkinson's. As you can attest tonight, we did not say that we want to fix Parkinson's. So to them, it doesn't make sense why you would see a chiropractor for a condition that's neurological, that's going to continue to progress. But our goal is to help them with their quality of life, with the compensatory things that happen because of Parkinson's. And my gosh, if we can increase their quality of life by 5%, 10%, who is not going to want that in a condition that's going to continue to get worse, that creates depression already? Why would you not want to get rid of something that you can get rid of, or at least control to a point where their life is more comfortable, or they're given a little bit more freedom because they can move a little bit better and prolong the whole thing, right? So
Yeah.
just want to be clear on that there is going to be a disconnect as to why a medical doctor uh, would say, no, you shouldn't say chiropractor with Parkinson's, because it comes from his mindset, and what, like, it doesn't make sense to him, because Parkinson's is going to be Parkinson's. A chiropractor is not going to do anything for that. And that is not the avenue that we're talking about. It's about the compensations that we can help with. Just wanted to say that
Yeah,
because I saw a
yeah, that's
comment come in.
that's a great point, because I think it has to come with a certain angle, and this goes for a lot of these neurological conditions as well. We all know that these conditions progress, right? We
Yeah.
all know they either progress, or they stay that way, or they slowly progress. But there are many things, many compensations that can be helped.
Yeah.
Like, just because you have Parkinson's doesn't mean that you're going to stop working on your balance, right?
Yeah, exactly.
Doesn't mean that you're going
Same
to stop
thing.
working on your flexibility.
Yeah.
You know,
Same thing
it's
with MS, right?
it's like,
Those are all conditions that you can be helped with other things.
yeah, it's like, I'm not just, like, if I have this condition, I'm not just going to sit around and take my medications and not do anything else on the side. You have to be very, very proactive in this care. And a doctor that will just prescribe you your meds for this condition and not talk to you about anything else isn't serving the whole.
Yeah.
And so
Yeah.
that's why we're here, to make that connection, because if he's not serving the whole, then maybe we can make this a
Yeah.
whole piece, right? Instead of just
I
half
mean,
the cookie, eat the whole one.
and talking about the whole, physiotherapy might help in this too, and prescribing certain, range of motion exercise and stuff that as chiropractors, we can also do, but, we definitely don't want to exclude any other practitioners that can help. Massage therapy will help as well. But I don't do massage. I don't do physio. Physio doesn't do chiro, and massage don't do chiro. There's certain things that we do that only us can do in terms of activating the spine, and adjustments and stuff like that, and the impact that has that only chiropractors can do. Just like I can't do some of the things that physios do, right? So I
Yeah,
think at
yeah.
many times it has to be a team approach.
Yeah, 100%. And I mean, that's working with the medical doctor, working with the physio. And I just want to, quickly give a shout out to massage therapists, that will work with these patients to try and get that tone to calm down, because the muscles are extremely tight, and it does take an experienced professional to go in there with their hands and sort of work through that. And then another shout out to our friends, the physios as well, who are working to improve the balance with these patients. Um, you know, Encouraging them to move properly, get that full range of motion, giving the exercises what's safe and what's not, using certain modalities, I suppose, that may be helpful with this. So
Yeah.
there is definitely a team-based approach, sorry, that can work for the patients, and definitely help improve that quality of life. So there's lots of options out there. We're just saying that one of the more important things to improve upon for sure is definitely working with that nervous system interference and getting the spine worked and the spine adjusted. Number one would be my take.
Yeah, no, absolutely. So, guys, up to now, if you've learned something, please show your appreciation by sharing this episode. Why don't we just go out and just do that right now? Share this episode to your page, to your Facebook groups. A lot of people will not think about going to a chiropractor if they have Parkinson's, not for Parkinson's, but for the health of their entire body and helping with mobility. So definitely do that, because I guarantee you chiropractic is not top of mind for people that have Parkinson's.
Yeah. Yeah, just because that was such a good point to bring up, because there are so many conditions that people will go to the gatekeepers and then they'll be put right into a box, right? And that one word is what keeps you in that stagnant position, right? And
Yeah.
so being able to have that choice of knowing, oh yeah, well, I guess not all my back pain is due to just the Parkinson's alone. Some of this can actually be managed, and
Yeah.
worked on, is a thought that we have to be thinking about, especially in this new age, where we are trying to stay out of the only start seeking care when I'm sick approach and look more
Yeah.
towards I should be taking care of my body when I'm feeling well, because there is the opportunity to feel even better.
So here's one thing that's crazy, guys, and this is how something you hear could affect your health forever. So I had this patient who came in to see me, uh, and it was funny because she was having back pain, and her doctor said, well, maybe you should see a chiropractor, and so anyway, she starts, to see a chiropractor. She started coming to see me, um, getting great results, and I didn't see her for a while. And so anyway, she shows back up, and I said, so, you stopped coming, so anyway, she said, no, I was doing well. And at one point the back pain came back, but it came back and there was like numbness going down the leg. So she goes to see her doctor again, and he says, well, back pain, you can go see a chiropractor, but because the pain is going down your leg, you can't see a chiropractor anymore. So I was like, oh my God, like, because the pain's going down the leg, how many patients we see with sciatic pain? Like, and for him to think that all of a sudden, because there's pain going down the leg, it's now no longer a chiropractic problem. So if that happens for something like low back pain, and how many times does it happen for something like Parkinson's, where they have absolutely no idea about how chiropractic might help co-manage, that particular condition, right? So, if it can happen for something as easy like that, then, for sure it happens with neurological conditions where they're like, well, why the hell would you see a chiropractor? And we've basically listed all the reasons why tonight. So, yeah, so go ahead and share these episodes, because definitely somebody might say, wow, I never thought about it. We're going to check, a chiropractor. And it doesn't matter if they come to us, if they're listening to this episode, in the US or New Zealand or wherever they're at, good for them. And we help somebody without being in their hometown.
Absolutely. Absolutely. So supplement of the month, omega-3. This is the last day of the month of June. Supplement of the month, omega-3. We've been talking about this all month long. Improves joint health and bone strength, decreases inflammatory molecules. Our great office assistant, Alicia, was talking with Orthomolecular recently, and we have a product called Serenity PM. And so Serenity PM is another great product that helps reduce that nervous system stimulation. And so we're trying to get that nervous flow to calm down. And so in a condition such as this, Serenity PM may be helpful. I won't say that it generally will help with Parkinson's, specifically, but if you're looking for something that's natural, that's looking to calm down some of that nervous flow, Serenity PM, a product that we have at the office from Orthomolecular.
Yeah. And I'll just add one little thing, B complex as well. B complex is definitely going to be helping with the nervous system, which is why we use it in conjunction to help people sleep, because it calms things down. But outside of sleep, just from a general effect on the nervous system, you can definitely see benefits from Serenity. So here we are, guys. Definitely a pertinent topic, and we're seeing a lot of love here tonight from people that have been affected by Parkinson's. We had, a great friend from our family die of Parkinson's, and it obviously affects a lot of people. So all we're trying to do is help people here and give them, their option, and help you guys gain knowledge over what the condition is and what it can do for perhaps yourself, perhaps a family member, or a friend, or a colleague. And, we appreciate you reaching out to them by sharing this episode. I know some of you already mentioned that you shared it. I appreciate that, Barry. So go ahead and do that. If you're watching this episode on YouTube, you can definitely do that as well. And so thank you so much, guys. This is our 30th episode. We could not do this without you. We love doing this, and thank you for your feedback so far.
Yeah, definitely. Just last point. Everybody, whoever is having a holiday tomorrow, enjoy your day off. However way you decide to spend your day, spend it your way.
Yeah.
And thank you, Dr. Roach, for a great topic this evening. And I think we touched on some really great stuff here. And as well, one of the benefits, I think, is just us reaching out and being in the community, and and having this time to talk with everybody about topics that we feel passionately about. Something like this, it just takes me right back, like I said, to my days working with some of this population very closely. And you never know when something like this is going to come up again. So when you have the opportunity to work with specific populations, do so and expose yourself so that what these conditions are like, and the people that are living with these conditions, and who they are, and the difficulties that they're going through. And you never know, you might say, I watched this Hump Day Conversation one week with these two guys, these two chiropractors in Halifax, and they shared some really cool stuff. You should look into it. You just never know how far-reaching you can be. So thank you guys so much for tuning in tonight.
Absolutely. So guys, thank you so much. We're going to be live again next week on Wednesday, as usual, at 9:00. If you're new to this, thank you. If you've been with us since the beginning, likewise, thank you so much. And we look forward to doing this every week. And we will see you guys very soon with Hump Day Conversation number 31. Woo! Take care, guys. Love you and appreciate you. Good night.
What's up, guys? Listen, if you like this episode, you'll probably like the other ones. Chances are pretty good, so here's what you need to do. You need to like us and follow us on Facebook. Following means you get notified when these two guys are live. Next, family, friends. You need to share these episodes because you never know. You might help them because they need this information as well.
And guys, if you ever miss an episode, make sure you subscribe to us on YouTube. That way you can watch the episode over and over and over again.
Guys, we love you and appreciate you.
Take care.